excess salt intake is linked to high blood pressure, which in turn is linked to heart disease and stroke. Those are the biggest causes of death and disability in the UK and worldwide. If we can reduce salt intake, we can help prevent thousands of preventable deaths. Around 75% of the salt that we eat comes from processed food. It's been added by the food industry. So simply telling people to eat less salt isn't going to have an effect. And ideally, we can get policy actions in place that will help encourage the food industry to gradually reduce levels of salt in their products. We're recommended to eat no more than 6 grams per day, but currently we're eating 8.4 grams, which is 40% higher than that recommended limit. We also visit supermarkets in the UK and collect data on salt levels in popular food products. The idea with that is we want to show the public just how much salt is in their food and also the variation of salt levels in their food to show that it can actually be possible to make food with less salt. We found a link between salt and blood pressure, and that's a dose-response relationship. What that means is, as salt intake is reduced, our blood pressure is reduced. And we found that the ideal intake for the UK would be 3 grams per day, but we're currently eating much more than that. And the food industry are largely responsible for that salt intake. So over many years, we've worked with the government to develop a salt reduction programme to ensure that the food industry gradually reduce levels of salt in their products, taking customers on that journey, ensuring that they don't reject those products, and over time, lower salt intake. Based on our research, the UK government implemented a salt reduction programme. In recent years, we've worked with the Chief Medical Officer to ensure that salt reduction appeared in the annual report in 2018, giving high prominence to salt reduction in the UK. And it also appeared in the Prevention Green Paper as a result of our research and our lobbying. The need for salt reduction is still very much there, and we worked with Public Health England to ensure that new salt reduction targets were published in 2020, due to be met by 2024.